So welcome everyone to the Community Board for March 16, 2022 public hearing and regular meeting. We're going to go ahead and get started. The time is now 6:09 p.m. We're going to go right into our public hearing agenda for this evening, starting with our CEO of Woodhull Hospital, NYC Health and Hospitals Woodhull Hospital. Please join me in welcoming Mr. Greg Calise.
Hi, Mr. Salih.
So good evening, everybody. I hope everybody can hear me. Thanks for inviting me to give an update on Woodhull Hospital. So I'm happy to say that we have just gone through some real trying times, not just hospitals, but throughout the city, throughout the state, throughout the country with COVID. And I'm happy to see that Woodhull has, functioned and operated well. So we are doing well. We have survived, and we're actually doing well as a hospital. So we have had our share, but the staff has really worked together to make sure that everyone who came into Woodhull Hospital for COVID or for other reasons were well taken care of. It was not easy, especially for the last surge. For the first two surge, we had the option or the opportunity to bring in staff from around the country where COVID wasn't that bad for, but for the last surge, COVID was really bad throughout the country, so we could not really get a lot of staff from around the country, so we really had to function on our own. But like I said, we really held together. We did bring in some, we were able to get some additional staff. But for the most part, a lot of our staff, like every place else, were affected by COVID, did get COVID, not necessarily from the hospital, from what we realized that most of the staff who were getting COVID from the community, like everybody else, and they were bringing it in and affecting sometimes or infecting sometimes the colleagues, because the hospital is probably one of the safest places to be as far as COVID is concerned. But like I said, for the most part, we did well. We are strong. We are doing well. So in terms of COVID updates, so for the third surge, which kind of started happening around November of last year, December, January, during the height of the surge, we were probably seeing around, some days we had probably close to 100 COVID positive patients in the hospital. And what we realized is that everyone who was COVID positive was not being admitted for COVID, but people were being admitted for other things and happened to have COVID. So that was a little different from the first two surges. So from a high of maybe 100 in December and January, 80, 90 on a daily basis, during February and currently, the number of COVID positive that we have in-house is relatively small. For example, today we only had two COVID positive patients in the house today. And there are some days for the past few weeks where we have had zero. So that has decreased significantly, and that's a good thing, so that we are able to breathe a little bit within the hospital, because the staff, as you can imagine, are pretty stressed. They have been going nonstop for a very long time under extreme conditions, taking care of patients, and even when it meant that themselves and their families were at risk. But like I said, we are doing well. All of the staff that were affected by COVID at Woodhull have now returned. So we are kind of working with a full complement of staff, and it's good. Unlike the rest of the city, within the hospital buildings, we still require masks. So all of the staff within the hospital have to continue wearing masks while they're in the hospital. In terms of vaccines and testing, we had a robust vaccine and testing program during COVID, the height of the COVID. So for example, vaccines, we were administering close to 400 vaccines, COVID vaccines a day, probably in December, January, February. Now that number has reduced significantly. Maybe on an average day, we do around 25 to 30 vaccines now. So the demand for the vaccine has reduced significantly. Also for testing, the same thing. During the height of the last surge, maybe in December, January, we were testing some days close to 800, 900 persons Now, again, the demand for testing has reduced significantly. So on an average day, we are testing around the same 25 to 30 persons for COVID. But we continue to have the vaccine clinic and the testing clinic on site. Both are operating Monday through Saturday from 7 to 4. And obviously we have downsized the operations based on the demand. Because of the fact that the demand is so low now, we are considering phasing them out and making sure that persons who are requesting vaccines, they would probably still be able to get it within the hospital, but not in a dedicated vaccine clinic. The same thing with testing, because there are so many testing sites that are in the community that hopefully we can partner with a lot of the sites to ensure that everybody who is requesting testing is able to get a test. We also given away the at-home test, so folks who want the at-home test, they can get it from the hospital. In terms of utilization, so what we are seeing now is we are going back to normal, like I call it normalization. So the volume, the utilization, the numbers that we're seeing are consistent with what we normally see around this time of the year. This is usually flu season. So we normally see more patients around this time. And we are seeing that, like I said, not necessarily COVID patients, but all other regular patients we are seeing. So on the inpatient side, again, that's normally full, almost full. So that's we almost full house for medical surgical patients. Surgeries, during the height of the COVID surge, we had stopped elective surgeries and we're only doing emergencies and urgent surgeries. So we are back now doing elective surgeries, and that's a good thing. So everyone is back on schedule. The emergency room, the volume is relatively normal. So, we back seeing maybe on an average day, we see maybe around 250 patients in the emergency room a day. Behavioral health, we are back to normal volume. During the height of the COVID surgery, we actually had one behavioral health unit out of the 4 that was a COVID positive unit. So all of the psychiatric patients who were COVID positive were being housed in one unit. So at this point, we have no behavioral health patients that are COVID positive. So we are back to normal operations on all behavioral health units. Pediatric is back to normal. Women's health is back to normal. And again, that varies on a day-to-day basis. So that's back to normal. And ambulatory care is also back to normal. During the height of COVID, we had reverted to televisits, where we are doing a lot of folks, as televisits. Now, for the most part, we have back to in-person visits for most of our outpatient clinics. So that's a good thing. Let me see, what other updates? So visitation policy, during COVID, visitation was restricted. As you could imagine, we wanted to make sure that folks were not bringing in COVID to patients. So we had restricted visitation, except for certain areas like women's health, OB, pediatrics, those areas we still had limited visitation, but for everybody else, we really had stopped visitation. At this point in time, we are back to almost regular visitation. We are allowing at least 2 visitors per patient at any one point in time, and visiting hours is back from to 12 midday to 8 o'clock. The other thing that we still have to do is what we call the point of entry screening, because the federal government and the regulatory agencies, CMS, require that we screen everyone who comes into the hospital for COVID. So we are required to ask certain questions. There are like 4 questions that we have to ask everyone, and we have to still take temperature. So everyone who comes into the hospital through the lobby, we have cameras that do the automatic digital screening for temperature. And we try to make sure that everybody gets answered the questionnaire. So that would continue until the CMS and the other regulatory agencies tell us that we can stop, but we have to do it as a safety precaution. Let's see, the emergency room. So we have recently, expanded the emergency room. We have really increased the footprint of the emergency room, well up to state-of-the-art renovated space. And we're using that occasionally. We have net, again, it's all based on the demand and based on staffing. So some days when our staffing is not enough to keep that area open, we are closing it. But as much as possible, we try to keep that new expanded emergency room open. In terms of new services, so we do have a lot of exciting new services. One of the hottest new service that we have is bariatrics. So we do have Dr. Javier Andrade, who is a well-renowned bariatric surgeon. He joined us several months ago, and he is doing well. Our bariatric surgery volume has just increased significantly. So that's one of the new services. And we know that in our neighborhood, there are a lot of obese and oversized and overweight persons who would like bariatric surgery. So that service, like I said, is doing well. And we are open for business, as many people as possible who want the procedures. We are doing it. Another new service that we have just added at Woodhall is something called the Mohs Procedure, which is a dermatology procedure for people who have suspected skin cancer tumors, where we are able, when they come in and one day we are able to look at the tumors under a microscope, and determine whether or not those tumors are cancerous, and if they are, then we can take care of it at the same time using that special procedure. So that is doing well. That service has been running for several months, and that is, again, that's the service that's in high demand. So these are just some of the new services. So, I mean, if there are any questions at this point in time, I'll be happy to answer those questions. But for the most part, Woodhall is back to normal. And we want to thank the community for its support, because everyone has been so supportive, from everything from helping the staff, supporting the staff, and just being understanding of what was going on within the hospital walls, words of encouragement to the staff. So we really want to thank the community for your support that allowed us and helped us to function effectively and to continue to be, an excellent hospital. So if there are any questions at this point, I'll be more than happy to answer any questions.
Jose? Oh, still on mute?
I'll start off.
Yeah, Jose has his hand raised. Josh, I think he's unmuting. Yeah.
Yes, hi, good evening, everybody. Jose Guzman. Mr. Caleb, Community 4 meeting. Just for full disclosure to you all, I happen to be the chair of Woodhall Community Advisory Board as well. And I just want to thank you, on behalf of the residents, the community members that I work, for all the outreach and the assistance that Woodhall did throughout the pandemic. That was one of the first places that we were able to send residents for testing. And when the vaccine became available, Woodhall was a huge partner, making sure that our seniors were safe. So I just want to thank you and thank the staff from Woodhall for all this amazing work that you all did throughout the pandemic and continue to do. Thank you.
Again, we want to thank the Community Advisory Board, because, Jose and the members of the CAB, again, a tremendous support. So we want to thank you also for your support, Jose.
All right, Josh?
Yes. Can you speak on what programs or initiatives Woodhall has going on regarding mental health? Because I know most times if you go to Woodhall after 11 p.m., you'll see a lot of mentally challenged people in the lobby, in the triage area. So I want to know, what is Woodhall doing specifically to address the mental health crisis that we're dealing with in the country, but specifically in Bushwick, given that it's prevalent in the area of the hospital?
And again, most of the services that we provide for mental health are based at Woodhall. So anyone who comes into the hospital that have a mental health condition, we take care of all of the persons who walk into the hospital. Everything from emergency services, we have a comprehensive emergency room that provides emergency services. We have an extended observation unit where we have 6 beds for persons who that we are not sure that needs hospitalization, so we can hold them into the extended observation unit for 3 days, while we get more time to evaluate them to determine whether or not they need to be hospitalized or whether or not they can go home. We have a comprehensive outpatient mental health services that treats both adults as well as children. We have the inpatient services, and like I said, we have 4 units. That's a total of 94 beds for anyone with psychiatric conditions that need to be hospitalized. And the average length of stay for most of those patients is probably around 15 to 20 days. And then we have chemical dependency services for persons who have substance abuse problems. Several years ago, we used to have a detox, an inpatient detox unit, but we no longer have inpatient detox, but we do have comprehensive outpatient detox services for persons who are chemically dependent. So we have a comprehensive array of services, and we do partner with a lot of organizations to be able to make sure that we can respond to the needs for behavioral health services. And if anyone needs us to be a little more proactive in any particular area, to partner with any community organizations to enhance services for behavioral health, we'd be more than willing to do it.
Right.
Celeste?
Yes, any other questions? I don't see anything in the
Celeste.
chat. Yeah, I'm sorry, go ahead.
Sorry,
Ms. Carr.
Celeste. There's actually a question on the chat from Yudelka. She's asking, what is the name of the doctor again?
So it's Mr. Khalees.
For
Yeah.
bariatric surgery?
No, this was earlier, so I'm
Yeah,
pretty sure it's
for
for
I mean,
So-
the only doctor's name that I mentioned was the one for bariatric surgery. His name is Dr. Andrade, Javier Andrade.
Okay. Go ahead, Mr. Camacho.
I want to thank you for your great leadership. I have been on that board many times, the advisory board, and I'm happy to see that Mr. Guzman is our chair, because he represents Bushwick. So we know you're in good hands, because he'll come back and he'll let us know if you don't take care of our people. We make sure that we got good people in there, because we do. I work with Juan Martinez when he used to be there, and so does Mr. Usino. So I've been there. My daughter was born there when the hospital opened in '83. So it's been going to be 39 years. So I know very well Woodhall, and I know the services it takes 4 catch basement areas. So we want to make sure that that community, that hospital is still there for us. And I also want to thank Jessica Arocho that you guys hired, because Maria used to be there before as a community advisor there in your hospital. She is from the community. I know her very well. She's on Borinquen Plaza. I know them very well. And she's key on in helping us in whatever we need. We're going to put her to the test for the shape of Bushwick. She promises stuff, so we're going to make sure that I knock on her door and get the stuff going on, because we have a shape of Bushwick. Am I right, Mrs. Davis?
Yes, you're right.
So I want to make sure that we're going to put you to the test. You know, we stay in the sideline, Bushwick State, but we go in there and we visit. We got a lot of board members going there, visit. You don't know who they are. But now we know that Guzman is the chair. So I'm going to be calling on you when we got problems and headaches and we need to take care. We want to make sure our people get the best quality service and with no pay. You know, if they could pay a little something, we don't mind them paying a little something, you know, because everybody got to pay something. But we want to make sure that it's the best quality and that people can continue to come back and make sure that we have that there, because I remember in the 80s, they wanted to make that a prison. And we said, no, we don't want no prisons. We got enough prisons here. So we want to make sure we keep a hospital for our families. So I want to thank you. And Celeste, could you open up to the public and maybe they might have any questions? Thank you.
So thank you, Mr. Camacho. There are a few already in the Q&A. This is from Mohammed Kadir, a student at the CUNY School of Medicine. So there's questions on several points. I'll start with the first one. Is burnout a concern at the hospital, and what countermeasures are in place to tackle this issue?
Is what?
Is burnout a
Yeah.
concern at the hospital, and what countermeasures are in place to tackle this issue?
I mean, burnout was a concern, especially during the COVID surge, because like I said, the staff was really stretched thinly. At this point in time, with the reduction in COVID cases and the trend back to normalization, burnout is no longer such a major factor. Like I said, unfortunately, we have gotten some relief. So at this point in time, burnout is not a major factor. We are in the process of recruiting for every profession, even including physicians, nurses especially, because in some cases, we do have a shortage of nurses, but we have been fortunate to be able to recruit a lot of nurses recently. So at this point, like I said, it's less of a problem and a concern than several months ago.
All right, thank you. The next question, it starts out by providing some context. The ER room was expanded due to demand, considering the high level of uninsured patients in Bushwick, along with greater rate of chronic disease within the community. Are there any measures in place to ensure that patients receive the appropriate care they need so that they don't need to use the emergency services?
You know, and we would prefer if folks, you know, were connected to primary care and ongoing care, as opposed to using the emergency room or the emergency services as a place for primary care. But we are obligated to see everyone who walks into the door. So everybody who comes to the emergency room, we have to see them. But what we do a lot more at this point in time is once we have seen you, we try to connect you to primary care, where you would have a regular physician, your own physician that you'll be connected to, and you can get regular services, so you do not have to go back to, hopefully you would not have to go back to the emergency room for routine services, but you'll get that from your regular physician.
All right, thank you. And the final question, are there any other programs or tools being employed to counter the rates of obesity?
Yeah, well, I mean, we have a whole nutrition service that focuses on trying to make sure that people eat well. We have services in the primary care clinic that focus on obesity and trying to make sure that we can prevent the incidence of obesity. We have just started a plant-based nutrition program that's really promoting plant-based diets to the patients as well as the staff, and that's working it's just started probably around 2 weeks ago. An extension of the Mayor Eric Adams' whole initiative on plant-based diets. So we have started that, and so far the reception and the responses and the demand for that is very good. So, you know, we are trying to address obesity from many different angles. We hope people do not get obese, but if they do get obese, now we have the option of doing the bariatric surgeries to be able to help them to lose the weight.
Thank you. And I don't see anything in the Q&A, although I do have a few things in the chat. Just want to acknowledge the shout out from Jose in regards to one of our board members, Ms. Mary McClellan, for also being a CAB Woodhall member for several years, probably more than several at this point.
Yes.
And then there's also a question. Are you articulating with the local precincts according to the mayor's new police initiative? So I'm not sure what this is speaking to.
Well, I mean, we have just gotten funded from the city to initiate a violence prevention program in conjunction with the WIC program, the WIC violence program. So we're in the process of implementing that now at this point in time. We always collaborate well with the precincts, with the police and that kind of stuff. So we continue to do that. But with this violence reduction program, I think this gives us an opportunity to even improve the collaboration with NYPD and all of the other law enforcement agencies. So I think that's going to be a very, very successful program.
Okay. Thank you. And oh, go ahead, Mr. Camacho.
Yeah, I think what they were talking about more was in regards to the mentally ill and them being taken off the trains. receiving some of your services if possible, I think it is.
Like I said, I mean, as the gentleman said before, we do have a large mentally ill population that uses Woodhall, and we try to do our best with providing the care. Unfortunately, for a lot of the mentally ill, and homeless, it's a revolving door. So you see them today, you take care of them, you get them well, but unfortunately, when they go back on the streets and they have no homes to go, it becomes very, very difficult to maintain that sanity. What we have done at Woodhall is we have partnered with Community Life, and we have actually built a building on the Woodhall campus where we actually partnered with Community Life to be able to provide permanent housing for people with mental health. There are 94 units in that building, and that program has been going well for 2 years. So well that we have now agreed and we have funding for a second building that's going to be built on the Woodhall campus right next to the first building. So for example, patients who are discharged from Woodhall, as well as from other hospitals who are homeless, because we know that, the best cure for homeless people is to give them a home. So even when they have mental illness, so like I said, our partnership with Community Life, unfortunately, we are restricted in the number of units that we have, but so far 94 units, and that's always full. And the persons who have been residing, the mentally ill and homeless people who have gotten units in that building, they are doing well because we're tracking them. They're connected to care at Woodhall Hospital. We provide the care, and Community Life provide the social and the residents and all of that stuff. So that's an excellent program, and that we're going to be publishing the results of that for the last 2 years, but it's doing well and we are expanding.
Thank you.
All right. I don't see any other questions, just some information in the chat. Last call, board members, members of the public.
Oh, my name is Robert Clayton.
Yes, sir.
Okay, I'm sorry. I'm new. I'm from a new group that we're starting in Bushwick called Bushwick Strong. But I want to talk to the doctor because I'm an LVAD. I'm wondering how come Woodhall is not getting anything for the cardiac unit to increase the heart conditions in the community. And being I'm an LVAD, and I know you know what the doctor. A lot of men don't know what an LVAD is, but I have a left ventricle assistant device pump put on the side of my heart to help me pump my blood. And when I'm out and about, I'm battery operated, and I can plug into a wall at home to order for my heart to function. So being I don't have to go to Maimonides and I don't live but that far from Woodhall, how come you guys don't have a cardiac unit that deals with LVADs?
And again, everything is based on the need and the demand. So if we realize that that's a significant need, we will provide the service. As a matter of fact, very soon we're going to be doing a community health needs assessment where we're going to try and be getting input from the community.
Yes.
To determine what services that are needed in the community that we don't offer. And then based on the results of that community health needs assessment, then we're going to determine based on our resources what other services that we can add to Woodhall Hospital based on the community needs and demands. So, I mean, the public is invited to participate in that community health needs assessment. And the more people that say, yeah, we need that particular service, I mean, if it's a few people, then it's not really cost effective for us to do it. So what we try to do is to make sure you get connected to even a program within Health and Hospitals that does it. But I'm pretty sure that Bellevue or one of the other bigger hospitals will have it. But if, like I said, if you can just kind of, let us know, and we could make sure that you get connected to, I'm not sure exactly where you live, but if you said Maimonides, but if Maimonides is too far, then we could make sure that we can find it for you where else is offering that service, even within Health and Hospitals, and get you connected.
Okay. Thank you.
Great. So this concludes this public hearing item. Thank you so much, Mr. Calise, for joining us. And thank you, Jessica, for your help coordinating this. We really appreciate you and look forward to working together moving forward to address Bushwick's health needs. We have to move on with our agenda now. You're welcome to stay. We understand if you have to go. But we'll be going into our second agenda item. First, I'd like to acknowledge that we have our council member Nurse is with us this evening. Council member, I don't know if you want to say anything. This would be the time if you want to share anything.
Hi, good evening, everyone. So glad to be with you for another month. I won't take up too much space because I know these meetings run forever and I know we've got a lot to talk through. So I just want to say hi. I'll put my information in the chat, and any upcoming events we'll put in the chat as well, or put in the community announcements so that the public discussion items could be moved on to. So thanks for Celeste. Thanks for letting me say a few words.
Of course. All right.
Thank
With
you.
that being said, we'll go ahead and move into our second agenda item, which is, of course, the Bushwick Avenue Traffic Safety Study presentation. This was done in partnership with Council Land Use, our former council members who have moved on now, both helped us put this together with their support. You will see the date. I'm about to share my screen. It says June 2021. That was just the final presentation from Council Land Use, although the information that the committee has discussed largely remains the same. There are some amendments that we'll get into that were from last week's or the committee meeting that happened recently. All right. Is everyone able to see my screen? Yes? All right,
Yes.
perfect. Just move this and we'll go ahead and we'll get started. And we're going to give a high level overview. We're not going to go too in depth because we want to save more time for questions and comments. But this is just to give you an idea of what we'll be discussing. All right. So the study area, folks may be familiar with the boundaries, some perhaps are not. But you can see from this map the boundaries of the neighborhood and the areas that we focused on, specifically the entire corridor of Bushwick Avenue, which goes, I believe, all the way from Conway on the, I don't see the legend, I believe that's the south, and then of course Flushing Avenue on the north. And then these are a few statistics about the neighborhood. It's about 2.3 miles long. And then a little bit of information on the land use. So the majority, I believe, is residential. However, we have a lot of community facilities along the corridor, 7 schools, 5 playgrounds, 12 daycares / Head Starts, 2 senior centers, and 2 NYCHA campuses. And this is a little information on both the increasing residential and daytime population. So some of the housing that we've seen created over the past few years from 2010 to 2020, 60% of those are in this area. So over 4,000 units, I believe. And nearly a third of the district's net new units are from Rheingold, the brewery development, which is in dark blue. And there's also a note here regarding 95 Evergreen, which was leased by the Human Resources Administration. There are over 600 staff and they're across the street from the new Rheingold developments. And this is a little information on the board's district needs statement. Board members should be familiar. Every year we engage in this process where we identify district needs and we of course advocate along with our elected officials to get funding for them. For many years, the CB4 district needs statement has included Bushwick Avenue along with some of our other corridors. Some of the issues that were highlighted, that the roadbeds remain in poor condition, inadequate safety traffic safety features. On the other side, high volume of evolving mixed use traffic, pedestrian, cyclist, vehicular, a need of additional investment, and so on and so forth. The Bushwick Community Plan, folks may remember from 2018 when the plan itself was published. For many years before that, we worked very closely with the then council members as well to come up with a lot of the recommendations. Bushwick Avenue was also featured prominently, including a request for a study. So now we get a little into existing conditions. This just describes what currently is present on Bushwick Avenue. We know that there is peak travel demand. We have the no standing Monday to Friday, 4 p.m. to 7 p.m., both on the west and the east side. And also, everyone in the neighborhood should know parking is a challenge, especially those that do drive. People often use front yards for parking, even without a curb cut. And then you have unsignalized T intersections. So these are the intersections, I believe, that you may see area to walk across, but you don't have the crosswalk signal to alert you when it's safe to walk. And there's no bus on Bushwick Avenue, except for the B38, which turns on Kasuth and goes on to DeKalb. We know that there are issues there because of the unaligned streets. Mr. Camacho has spoken emphatically on this to make sure that this intersection in particular is studied further. And we get into a little bit of the work that's been done by DOT in regards to Bushwick Avenue. In 2015, the Vision Zero Pedestrian Action Plan identified Bushwick Ave as one of 49 priority corridors in Brooklyn. And then some of statistics from 2009 to 2013 and 2012 to 2016, pedestrians that were killed or severely injured per mile on Bushwick Avenue dropped 50%, and it was delisted as a priority corridor. It's unfortunate that as of, I believe, 2020, we had another fatal accident, a cyclist by Knoll Street. We wrote to the commissioner back then, emphasizing the need for additional safety features on Bushwick Ave. And a little on crash history. This just goes into statistics from 2017 to 2021, 3.25-year period. Showing some of the intersections that we identified and the crash data, crashes with injuries, total deaths in these intersections. Bushwick Ave has the highest crash and injury rating of the 5 corridors studied. And this is a little more information, the crash analysis. Really, this data is being used to make our case, right? We're saying this is all the information we have. And this references the 2 pedestrian deaths over 3.25 years, November of 2020 and August of 2017. And again, over a period of time, you'll see that it varies. And the proposed focus intersections for this study, we know the corridor is long, so we want to make sure that we're giving both DOT and any other agencies involved guidance on where they should focus their efforts. Knoll Street, Myrtle Ave, Gates Avenue, and Cooper Street were preliminarily identified. And these just go into the specific recommendations, which we'll summarize towards the end of this presentation. All right. A little bit on precedents. This is work that's been done. Some folks may be familiar with Vision Zero. Includes education and also enforcement. So education is largely conducted by DOT. They will send staff out to the neighborhood to engage with community members, encouraging them to stay safe, and also reminding them of local traffic laws. You also have enforcement, both the NYPD and the Taxi Limousine Commission. They work to reduce traffic fatalities and serious injuries. And Vision Zero also talks a little bit about engineering, designing better streets. Some standard tools include, but are not limited to, signal timing, striping and high visibility pedestrian crossings, leading pedestrian intervals or LPIs, center median with left turn bays, pedestrian islands, and curb extensions. We've seen some of these, I would say, over the past, 8 years in the neighborhood in different areas. And then the unique challenges of Bushwick Avenue that some of us may know very well. High vehicular volume, depending on the time of day. It's relatively narrow, only 40 to 50 feet. Parked cars must move every 21 hours on weekdays. Mostly low-rise residential and row houses, although that's rapidly changing. Relatively close spacing of intersections. And other safety projects. This goes into a little bit of how or what we see in those projects. And this is just an example from the Bronx, where they did some improvements. Another example in Prospect Heights in Brooklyn. You can see the striping and see the result. And now we get into the recommendations, which the committee, you'll hear from them in Ms. Jackson's report a little bit later. Truck route signage, updated signage alerting commercial vehicle drivers of the local truck routes, Myrtle Ave and Broadway, and that Bushwick Ave is not a truck route. We hear this very often from board members, community members. There needs to be adequate signage. And there are just some photos with examples. And of course, we know NYPD is also out conducting enforcement and education around this, but this is a big issue along the corridor. Unsignalized left turns and peak direction lanes. This goes into, of course, the AM and PM peak direction lanes make it difficult for intersecting traffic to make left turns at unsignalized intersections. Restricting left turns to and from side streets at unsignalized intersections during the morning and evening would help to prevent conflict. And they give some examples here. Could be limited to the peak side of the street. For example, no left turn from Knoll Street to Bushwick Ave during the AM peak hours. And no left turn from Bushwick Avenue to Dodworth Street during the PM peak hours. For Knoll Street, study installing a signal and crosswalk to provide safe and direct pedestrian access to Beaver Knoll Park. Install speed cables on Knoll Street to discourage through traffic. Through traffic should continue south on Stanwicks and should access Bushwick Avenue via Melrose Street. For Myrtle Avenue, install new high-vis striping for all crosswalks, stop bars, and lane dividers. Paint elevated piers safety yellow. Improve lighting under the L. Willoughby, fix the hole in the sidewalk on the east corner that partially blocks the curb ramp outside 674 Bushwick Avenue. And we know that this isn't the only location in the neighborhood that has an unfixed street infrastructure. Please let us know if you see anything else like this that is a safety hazard. Should be covered with the cone and repaired. Dodworth Street, study installing a signal and crosswalks at this intersection. Distance between next closest signals at Lawton Street and DeKalb Avenue is over 460 feet. Typical block is around 200 to 250 feet. And while we were reviewing these recommendations, I just have to note a homeowner at the end of, I believe, Lawton Street contacted us when a car drove straight, didn't make a turn on Bushwick Avenue at all, and literally almost drove into her living room. She was bringing groceries inside and she had stepped, but she stepped away, like she had stepped and she didn't step into the line of traffic, but it was so quick that she barely even noticed the car had not stopped. And almost it busted the entire gate in the front of her building and it left shattered glass all in her living room. Thankfully, everyone was okay, but they were very concerned and also, of course, supportive of this study as it will hopefully improve conditions along Bushwick Avenue. At Kossuth and Stanhope, which we mentioned earlier, talking a little bit about the B38 articulated bus. All other traffic must turn right, although the bus turns left. Limited queuing space for the buses before reaching light at Stanhope Street. The vehicles turn left from Stanhope Street onto Bushwick Avenue, often block the bus or block traffic and the bus. So the recommendations here are to restrict left turns from Stanhope Street. Investigate if an extended green at Stanhope for buses heading north on Bushwick could reduce queuing. And at Menahan, unsignalized intersection with curb cuts but no marked crossing. Distance between next crossings at Bleecker Street and Grove Street is over 450 feet. Install a light timed to adjacent intersections and install pedestrian crossings. And daylighting, so controversial. However, it restricts parking close to the intersection to improve visibility for all road users. Turning and crossings are most dangerous when Bushwick Avenue crosses another two-way street. These streets are also bus and truck routes. Daylighting can help to improve visibility. Recommendation, daylight these intersections: Cooper Street, truck and bus, Halsey, bus, and Gates Avenue, bus. And for Halsey Street, it was flagged as possibly needing a leading pedestrian interval. And for folks that are less familiar, daylighting does take one parking space. However, Folks can tell you at the corner of Ditmar Street and Broadway that daylighting can save lives, because when a car, a truck, any vehicle is there and you can't see what's happening on the other street, you can easily get hit or other accidents can occur.
Yeah, someone was killed on Ditmars.
Yeah. All right. And now we open up for questions, any comments from board members and from the public. I'll stop sharing. Right. Councilmember Nurse.
Not too many questions. I just want to say this is really great, especially daylighting over Halsey, Gates, and Cooper. I think would be a world of difference over there. Not only because it's a little bit dark, the street is split by a post from the train, so it's already confusing. It's confusing where you cross there sometimes, and people always try to rush across. So I think that would be really incredible, and coupled with some actual improved lighting over there in that area, especially around Deerfield, which is something we also mentioned to DOT. The signage around Kossuth and Bushwick Ave would be amazing. The only ticket I ever got, the only time I ever got pulled over was because I made that turn and I just didn't see the signs. And so that was, that would be a huge improvement. I'm also interested in the kind of design options along Bushwick Ave to break up the middle of the street. I think that was a really nice visual. I have an opportunity to potentially bring in some plant life along the corridor, which help with absorbing, some of the toxins that are coming from that, just the high amount of traffic going down that area. So I just wanted to say this is really, really fantastic, and thank you for everybody who put in time on this. It's much needed, and I thoroughly support this.
Thank you. And I want to give a quick shout out to the 83rd Precinct. I know we had someone last month that asked about Eastern Parkway and identified it as a dangerous intersection. Captain Claxon did follow up with us and confirmed that they do have data, and he sent us our recommendations for Eastern Parkway. The committee did discuss those and plan to include them in the recommendations, although they weren't featured in this presentation. All right. Mr. Camacho, anything?
Yeah, I just want to thank Celeste and myself. I give myself thanks, and the young man that came out to do the study with us. We spent a couple of days out there, and we physically. It ain't like we sat in the office and we went to the field, saw the conditions occurring and happening. So everything that is being proposed here was physically seen. All those pictures were taken with me and Celeste and the individual that was doing on the spot. All the traffic and congestions from 4 on was on the spot. Everything that was on the spot. So we did our due diligence. I think DOT should reimburse us for us doing a survey for something they should be doing, because other communities and other areas, you see beautiful things and you see the way you could cross. Manhattan, the bikes have a light that they could, red light and a green light, and Bushwick has no lights, no pavement, no painting, no tree pruning, nothing. So I think we should be finding out what's going on, that we don't got them beautiful services that got there, and we need to push some more service along Bushwick, along Broadway, along Cooper. Cooper is I don't know how people even commute there. Cooper is Halsey is even worse. I just don't understand. And with the trucks and I don't know how. I really don't. So we really need. I just want to thank Celeste, because we sat out there a couple of days, a couple of hours, and going in. The guy did a beautiful job, man. As you can see, everything that's on this was in the field and done. It ain't like we stood in the office, got a computer. Everything we done on the field. So I want to thank Celeste and the young man for making time for us to do the survey. So thank you, Celeste.
Yeah.
Thank
That
you,
was
Mr. Camacho.
a real good thing. That was a very good thing, Mr. Camacho, because this is Barbara. On my block, I tried to get a light. It took me 9 years to get a light on the corner of Decatur and Wilson. And we had tremendous cars running into the pharmacy front door window. So I'm hoping you put all of this in, but they have to make it move faster. They really have to make it move faster.
Yeah, and our law end, a car went straight down Bushwick Avenue to an apartment and it was crashed. The gate straight
Yeah.
down, straight down. Somebody, imagine somebody crossing the street or a kid coming out of school. You get killed. He went straight into the wall. And in the house, lucky the lady wasn't in the kitchen or something. It went right through. We couldn't believe it.
We had over 150 car accidents on the corner of Wilson and Decatur, because Wilson's a two-way street with buses. Decatur's a one-way. The corner needed a stop sign. Cars was banging into each other because trucks was parked on the corner. DOT just sent people and they were like, not needed, not needed. And it took 10 years to get a stoplight.
No, DOT says not needed in their desk, and they look in the computer. They don't go out to the field. They need to get out their desk and go out to the field and see what we're talking about. That's why when all the time I tell DOT, no, I don't want to hear it. Let's go. Let's take a day. Let's go walk for you can see. Come at this time. I don't want to hear you looking in your computer. Oh, it's not unfounded. No. Or they put a piece of tape and that day there's only 2 cars. Okay, unfounded. But when they leave the next day, you see 100 cars coming by. So we really need to put DOT by the fire.
Terrible how they take so long. I even had one of our OSO, Glenn, went out and had the officers taking pictures of the corner and send them in. And it still took a long time. So I'm hoping DOT works better. Thank you.
Councilmember?
Just one other thing I wanted to raise is that along Bushwick or off in different places where I know the city bike docks are located, they're not always located where a bike lane is. And so sometimes that can also, you have a bunch of people coming in and out, offloading and unloading bikes, and that becomes a safety issue as well. So just bumping that up, I know it's not noted in here, but it's something that there was recently a woman who was killed off of Eastern Parkway over right here by Broadway, coming up using one of those bikes, and just, you know, there's in places where those things are not corresponding to other types of transportation infrastructure, it's a big issue. And that we did raise a bunch of lights. A bunch of people have called and said about lights that are out along certain corridors. So we did just recently raise that this last week with the Brooklyn DOT commissioner, as well as the bike issues and where the docks are located being better coordinated with the existing bike infrastructure. But anyways, this is really great, and thank you for all the work you've done around this, and I'm looking forward to pushing for these changes, but just mentioning this other piece as well.
Councilmember, I just want to reiterate what you said. We told them that. What you just said, we told DOT that. So it ain't nothing new. This community told DOT that. We even told them we wanted to see a survey to see if it's beneficial that people are using it. If you're putting something there and the people are using it, okay, well, guess what? They're using it. But if you know there's no bike lane there and someone gets killed, guess what? They see bike racks, they're gonna go on Bushwick Avenue and they're gonna ride. So that's what's gonna happen. And we told them that. We also told them, since they put it up, we also told them that we want to see the survey in all these spots that they put all these bike racks to see if it's beneficiary, if they're making money. If they're not making money, give it back to the community where the people can park. Why are they holding positions just like these sheds that they got in there? Nobody's in there. Now, the people with the cars got to go all over and drive all over. Then we got the cars with all these plates. That's another issue. We told them that. But they don't listen to the community. They do what they want to do. When something goes down, then they blame the community board, just like one kid that got killed. I don't want that. Don't do that. And I'm not dealing with none of them. And we told them that. We also have minutes and reports telling that about specifically what you just said. But they want to make
I'm just letting you know I raised it again with them. And I know it wasn't listed in this thing, but it is, I know that it's present with you all, and we raised it as well. So I remember those fights.
So I just want to also give credit where it's due, and I see Juan. I'm gonna call on you right after I finish speaking. But I reached out to our former council member, now borough president's office, and I spoke with Asher, and I said, Asher, we need a transportation planner. What do we do? And Asher was the one that referred us to Sam Frommer, who worked with us on this study. So I just want to give them both thanks for making this possible and getting this work done. Juan, go ahead.
Hey everyone, I just want to say hello to everyone. Thank you to the community board for presenting this plan. I am with Councilmember Jennifer Gutierrez. She does support the plan overall. Regarding the the daylighting side, the council member supports this, but I think it has to be she believes it has to be something with enforcement as well. We can't have these cars and delivery trucks being parked where the daylight saving has to be. Regarding No Street, she's happy about this, installing a signal crosswalk. It has been something that has to be installed. So she's finally happy that this is happening. About the Myrtle Avenue, she supports the idea of putting a no truck route in Bushwick Avenue, but she also wants us to have a conversation with MTA about this. We also need a paint job, which will increase the lighting that is necessary at the location. But the only question that she has about this is that the enforcement between NYPD and the truck that's happening in the district.
Excellent. I'm not sure if our captain has joined us yet this evening. I know we have community affairs on with us, Officer Lopez. But if we don't have someone to respond right now, we can,
Here.
I see our captain. Hey.
Sorry. Sorry about that.
No problem.
Okay.
Are you able to speak to enforcement? Yeah.
Yeah, so I'm doing my spiel today right now, right? Sorry. I was in another meeting.
Oh, no problem. It's just responding to, we're talking about a Bushwick Avenue study and then just the NYPD's role in enforcement for on Bushwick Ave, yeah.
Yeah, so we've been talking with DOT, and also we actually had a meeting today about a different corridor, a Cypress Avenue corridor, which is very similar. And what we've been doing previous in Bushwick Avenue corridor is that we go out and we do 2 weeks of 2 weeks of education and then 2 weeks of enforcement. So we've done that in the past. We're not doing that in Bushwick Avenue right now. Bushwick Avenue is still one of our high accident locations, collision locations, especially over by Eastern Parkway. So we still focus on that regularly, daily actually, and to try to bring down those accidents. So that's what we're doing right now. But like I said, right now we're kind of focused on Cypress Avenue as well, but we still are focusing on Bushwick. Yeah,
got it.
So.
Thank you. And was very happy. I don't know if everyone was happy, but I happened to see NYPD traffic on my way to work the other day in the neighborhood. So we know that they're out there. May have been some folks that weren't too happy after they passed by, but got to do what you got to do. So, but if there are thank you. If there are no other questions going once, let me just double check. I don't see anything in the Q&A. Kim, if you don't mind, there's some board members that need to be panelists. All right, if there's nothing else for this item, we can move on. All right, so that officially closes our public hearing for today. Thank you, everyone. We're gonna go now right into our regular meeting, starting with the first roll call. Board members, please be ready. Reverend Grace Aites. Joanna Bennett.
Here.
Joshua Brown.
Present.
Martha Brown.
Present.
Raul Brown.
Present.
Robert Camacho.
Present.
Gardier Caphart.
Present.
Melissa Carrera.
Present.
Felix Ceballos.
Present.
Excellent. Luisa Chan is excused. Andrew Choi.
Present.
Daniela Davi indicated that she is moving out of the neighborhood and she will no longer be on the board. Elvina Davis,
Present.
Carlos Feliciano, James Fitzgerald, Freddie
Present.
Fowler. Oh, got you, James. Freddie Fowler, Igaudi Gomez, Christopher Graham.
Present.
Thank you. And Guy is excused. Jose Guzman,
Present.
Padilla Harrison,
Here.
Jared Hicks. I saw
Present.
Jared. Oh, gotcha.
Present.
Gotcha. Tanisha Honeygan, Barbara Jackson,
Yeah.
Kristen Jock,
Here.
Cheryl
So
Jones.
just like to say present, this is Igaudi, sorry.
Oh,
I was
gotcha,
just good
Gaudi.
panelist now.
No problem. Cheryl Jones, Virgie Jones.
Present.
Gotcha, Virgie. Luisa Jose,
Present.
Andy Marte, Mary McClellan, Imani Mitchell's excused, Desmond Monroe, Sammy Namir Olivares. Got you, Desmond.
Sammy
Kyle.
text me, he wants to be excused.
Okay. Kyle O'Rourke is excused, sorry. Zuma Novoa,
Present.
Asaya Polite.
Present.
Got you. Gladys Bulia is excused. Raul Rubio. Alicia Ruiz. Bernardine Shell. Barbara Smith.
Present.
Dustin Sonborn. Annette
Present.
Spellin. Oh, gotcha,
Present.
Dustin. Gotcha, Annette. Leo Teneo.
Present.
Jerry Valentine.
Present.
Carlotta Williams.
Present.
Oldolph Wright. And Frank Zimmerman is excused.
Got 30 board members, consult the quorum.
Yes, thank you, everyone. And we'll move on now. Excellent. With our second agenda item, which is acceptance of the agenda. Is there a motion from the board?
James Fitzgerald make a motion to accept the agenda.
Oh, I heard Annette Spellin first. Second, all in favor?
Aye.
Any opposed, any abstentions? So moved. Agenda item number 3, acceptance of the previous meeting minutes. Is there a motion from the board?
I make a
James
motion
Fitzgerald.
that we accept the minutes from the previous meeting.
Okay,
This is
Barbara
Autumn.
Jackson.
Yeah.
Thank
James
you.
Fitzgerald, second.
Okay, gotcha, James. Thank you. All in favor?
Aye.
Any opposed, any abstentions? So moved. And agenda item number 4 is our chairperson's report, Mr. Camacho.
I want to thank all y'all for coming and conveying me as your leader. I know there's a lot of board members that are not are going to fill out the applications and not no longer. I want to thank all of y'all. I know a lot of you guys been a long time. Some of you guys are moving on, but Bushwick want to thank you for all your services and helping us be Bushwick. We ain't going nowhere. We're gonna be here. So whenever you want and whoever's leaving, or we'll always be here. So I don't want to say, you know, I hate to see y'all leave, but you know, we're gonna miss you. We're gonna miss all you people. Martha Brown, I know that another board member, maybe he'll mention it later on. I don't want to spoil his thing. I know a couple of them are leaving. I heard and calling me and telling me that they're not gonna fill in. But thank you for your services. Thank you for all your help. Thank you. Bushwick is gonna miss the education that we had, and we all learned together, and we all to be one. Well, Thursday, February 12th, I went to the CEC meeting. Wednesday, February 23rd, the DOT, we went to Graham and Broadway, since that was CB1. All I said was that whatever CB1 wants to do, we're with it. But I guess they're trying to make Graham and Broadway a little smaller because too many accidents are going on over there when the bus turns. So I think they're gonna make a plaza. So and the person that's gonna be taking care of the plaza, they have a bid, they have a Knickerbocker bid. So obviously they're gonna be programming there. So Thursday the 24th, at 2 p.m. Shape of Bushwick Committee. Thursday the 24th at 6, Environmental Protection, Transportation and Parks. Thursday the 24th at 7 p.m. I was busy that day. PB at Brooklyn North, Moscow had a meeting for the borough. Tuesday, the 3rd of March, first, Brooklyn Borough Board meeting. NYC Engagement Commission, Andy Tartino, civil engagement specialist, and then they had a community board updates. So it's something new that they're doing is that instead of us calling, every board gets to say an update and what's going on in the community, and they can follow up. So it was pretty good. Wednesday, March 2nd at 2 p.m. I had given out PPEs at the garden on Grove Street with El Puente. Wednesday, March 2nd, CB4 Executive Board meeting. Thursday, March 3rd, at 1 p.m., the Brooklyn Borough Board rally with our Congresswoman Sandy Nurse. She had a lot of people there. Should be proud of her. She also had 2 big giant rats. I don't know what they were doing there. I was a little scared, but I think she put it on her thing. There were 2 huge giant rats in regards to the garbage and the rats. They're cutting the funding. I don't know if they put it back or they're gonna put it back. I don't know if Sandy Nurse had already left, but yes, that Thursday at March 3rd at 5 p.m. the sanitation work group. That Thursday, March 3rd, the Bushwick leadership at 6 p.m. I know everybody knows anyway. Maybe our chair from the youth will speak on it. On Friday, March 4th at 10 o'clock, Hope Garden update. It's just an update. Nothing changes. Friday, March 4th, 10:30, a council hearing with Sandy Nurse. Me and Celeste met with her to speak on priorities and budgets and how much good things she's gonna bring back to Bushwick. We need some stuff. So I'm gonna be bothering them. On Tuesday, March 8th, Hope Garden, 11 o'clock, garbage. We met with sanitation, and I want to thank Sandy Nurse for bringing sanitation to the forefront in regards to Hope Garden. Tomorrow is the TA meeting at 6, so hopefully they're gonna have good news for us. Tuesday, March 8th at 2 p.m. I think I already said that. We met with, I told you it was Sandy Nurse. All right, on Tuesday, March 8th, the EDC PL Parks Committee. On Wednesday, March 9th, at 10 o'clock, CB4 District Cabinet meeting. Everyone came, everyone comes from the District Cabinet meeting. It was, I'm so happy they all come. If we have issues and complaints, we can take care of them right there. Whoever has, please, whatever city agency, we had DOT, because we know I yell at them out all the time. We had Department of Health, we had the captain, the 83 precinct, we had National Grid, we had the Mayor's Community Affairs unit there, and Tony Herbert. I think he's on here today. I'm not too sure if he left, but he said he was gonna leave, but I wanna thank him. He's our new Community Affairs unit. We had Parks, we had FDNY, we had Con Edison, we had DOB, and we had DHS, which is the Department of Homeland Services there. So we had all the city agencies there. They give us their presentation. We tell them what we want. We give them all the concerns, and then we follow up. Then Wednesday, March 9th at 5, the Bushwick Historical Preservation Work Group. Then Wednesday the 9th, NCO Build the Block. I went to Sector David. On Thursday, March 10th, CB4 Health and Hospital and Human Services and Senior Veteran. Thursday the 10th, CB4 Civil Public Safety Religious Committee. On Tuesday, March 15th, the 83 Precinct Council. Barbara Smith had her first today. I was happy to be there, see all these people. It was fast though. I think it was faster than us, man. You just went in and all of a sudden we were out, but I guess she was happy. I was happy with that too. At Wednesday, the clergy, that was even faster than that. I don't know who won, but the chair for today was Reverend Avina Davis. So I joined her too. Then at 2 o'clock, me and Celeste met with the Senator Julia Salazar in regards to some of the budget priorities that we may have. We're going to meet with Maritza, Assemblywoman Maritza. We're going to meet with the land whenever they have the time for us. And today, the full board meeting. Any comments, concerns, anything in regards to our meetings, and that's it.
All right. If there are no questions for Mr. Camacho, I don't see any hands from board members. I don't see anything in the chat. We will move on with the agenda. Going once, going twice. All right. Thank you, Mr. Camacho. And next on our agenda, I believe, is the introduction of our elected officials and representatives. So I know we've already heard from our council member this evening. If there are any other representatives that have joined us, please raise your hand and I'll call on you to provide your name and contact info only. Any elected official representatives? I see no hands. Very unusual. Council member, would you mind sharing the office contact information just in case anyone needs it?
Yes, let me toggle some tabs here. So we are located at 1945 Broadway, at least for the next few months, right behind Broadway Junction. It's a dark little dungeon space, but we do have, it is lovely during the sunlight hours and the office is nice when you're inside. But we're there, we're open behind all of the big trucks. And our phone number is 718-642-8664. I'll drop it in the chat again. And we're open Tuesday through Friday. You can walk in from 9:30 to 5, and then every second Tuesday of the month, we're open all the way till 8 o'clock. And we'll be launching some satellite hours and extended weekend hours for folks who, you know, have lots of day jobs and can't make it to our office in time. So I'll put all that in the chat.
Thank you. I see Juan, and then we have a vet. Juan.
Yeah, hey everyone. I am from Councilmember Jennifer Gutierrez's office. We are located at 244 Union Avenue in Brooklyn. We are open from 10 to 5 on Monday, Wednesday, and Thursday. Our phone number is 718-963-3141. You could give us a call if anything, leave a voicemail and we'll get back to you. Can you repeat that?
Got it. No, I think someone just unmuted by mistake. And
okay. Thank you, guys.
Thank you. Yvette?
Hi, good evening, everyone. My name is Yvette Lopez. I am the Communications Director for Assemblywoman Maritza Davila, and we are located at 249 Wilson Avenue in Brooklyn. Our contact number is 718-443-1205. Unfortunately, I cannot stay on for long. I will put in some information in the chat in regards to our career job fair, which is going to take place on April 2nd. And I know there were conversations in regards to Bushwick Avenue and DLT. I wanted to make sure that it was on everyone's radar that there was an incident that occurred last week, Friday afternoon on Wilson Avenue. A 18-wheeler truck attempted to turn right on Myrtle Avenue and unfortunately broke the traffic light. So I reached out to the 83rd Precinct. Thank you, Lopez, for being a respondent to that issue. and responding to that issue. And I also took a secondary approach to reach out to DOT. So they're gonna give us an update as to when that will be fixed. Thank you so much.
Thank you. I also see Jonathan Pomboza.
Hi there, good evening, everyone. My name is Jonathan Pomboza. I represent Brooklyn District Attorney Eric Gonzalez's office, located at 350 J Street, and our phone number is 718-250-2340. Thank you.
Thank you. And I believe we had both Tony Herbert, the new director for the Community Affairs Unit, the Mayor's Community Affairs Unit for Brooklyn. And I saw Malcolm McDaniel, who is our liaison, although I think they may have had to jump off. Malcolm, if you're there, if not, I don't see anyone else from our elected officials' offices. If we did not call on you, it's not intentional. Please just drop your info in the chat, and there'll be another opportunity a little bit later. Next, we have both our city agencies and community-based organizations, just name and contact info only. I know we have a few with us this evening. I'll start with NYC Health and Hospitals. Jessica? We'll come back if you're not there. You may need to unmute, Jessica. All right, moving on. I know we have a few folks from the Bushwick Star.
I'm here. Can you hear me now?
Yes, we can hear you now.
Okay, thank you. Hello, everyone. Good evening, and thank you for having me. I just wanted to remind you guys, Mr. Caliste had mentioned about the community needs health assessment. I have sent it out in email blasts to the community boards, to community-based organizations, to the elected officials. So we will be having a meeting on the 28th, Monday the 28th.
Jessica, I'm so sorry. This is just name and contact information. Announcements are a little bit later in the meeting.
Oh, sorry. Okay. And so you just need my contact information?
Yes, yes, please.
Oh, sure. It's my number is 718-963-8140. And my email is arochoj@nychhc.org. Thank you.
Thank you. And I believe Lucy from the Bushwick Star. I know Jason is also on, as well as Vanessa, but Lucy, yeah.
Hey everyone, thanks for having me. I'm here in place of Noel, and I'm gonna pause to Jason because he's been here more regularly. Thanks so much for having me.
Of course.
Hi everyone, Jason Quinones here, Bushwick Star, the managing director. You can feel free to reach out to me. Noel is out on paternity leave, bless him and his family. He's becoming a dad today, so as you know him, he knows very well Vex in the community. So we're here on his behalf, and I'm sure he will give his love and appreciation for this board. You can reach us. Lucy Jackson is the interim. We have Vanessa here, but you can reach me at jason@thebushwickstar.org, Lucy at thebushwickstar.org, Vanessa at thebushwickstar.org. I'll have them say any words that they want, but it's a pleasure to be here. Feel free to reach out to us, and it's always a great being here every month. So
you scared me when you told me I thought he was giving birth, but tell him I said thank you.
We definitely will. He always talks about you, Camacho.
Yeah, but tell him how you shocked me when you said he's giving birth. I said, wait a minute, what happened?
Well, all right, you got me there.
All right, thank you. And I don't see, I see Millie. Millie, if you're still there, if you want to provide your contact info.
Sure. Hi, everyone. Millie Sandoval. I'm the Director of Organizing at Communities Resist. I just put all my information in the chat. You guys can call me anytime. We do legal housing. And I'm happy to be here. And a long-term community resident, last 50 plus years, right, Camacho?
Yes, there's a little bit of feedback.
Yeah,
I'm not sure what it is, but there's a little bit of feedback when you speak. We got a little bit of that, but some of it wasn't clear because of the feedback, Millie. I'm not sure what it is for the sound.
Okay, all right, I apologize for that. I don't know what's going on. Everything is in the chat. Been living in Bushwick for the past 55 years. Thank you for having me here, and I love your meetings.
Thank
Thank
you.
you so much.
Thank you.
Thank you.
Thank you. Yeah, I
All
gotta
right.
talk to you. We got some help. We need some help.
Yeah. All right. So I don't see anyone else again. If for whatever reason, this is just for community-based organizations and agencies right now. If we missed you, it wasn't intentional, feel free to drop your info in the chat and there'll be another opportunity to make an announcement a little bit later. We'll move on now to our precinct report. Captain Sanabria.
Hello? You hear me?
Yes, we can.
Okay. Good evening, everyone. Just a few things. I know that neighborhood safety teams is a big issue in the city, bringing back from what they called anti-crime from a few years ago. A3 is one of those precincts that has the neighborhood safety team. Monday was supposed to be the rollout, but we haven't rolled out because of they're still at training. They're going through intensive training, intensive 7-day training, where they're going through everything from constitutional stops to car stops to court testimony and things of that sort. So that's what they're going through. They'll be in the precinct on Thursday, and the next CB4 meeting, I will be introducing them to you. Each person will be on just so that you can see who they are, which I think is very fair, and 1PP thinks is very fair as well. So when you see them out there, you can say hello and you'll recognize them by their uniforms. It's pretty close to the NYPD uniform that you see now, except there's no side patches on their shoulders. And also you'll see that their names and where they're from are actually engraved, stitched into their outermost garments, so that there'll be no doubt of who they are, what their name is, and where they're from. And on the back, it'll say NYPD police, in case, it has come to where people were stopped, when people were like, oh, I didn't know they were the police. So they wanted to make sure that that wasn't the case with this new neighborhood safety team. So we will be introducing them to everyone. We will be introducing them to everyone in every board as well, the community council precinct, CB4, anyone who wants to see them and talk to them, that's who we're going to be introducing them to. In regards to crime, we are up in crime. However, we're only in single digits as compared to the rest of the city. The city has seen a significant increase in crime. The A3 has been able to kind of be even with last year, but that's just because of the work of our police officers and our sergeants and lieutenants out there trying to ensure that, Bushwick is the safest place that you can live. But we're working together. We're working together as a precinct with the community to ensure that we can do the best that we can to ensure Bushwick's safety. Our biggest increase are property crimes, which is usually the case in regards to packages being stolen, bicycles being stolen out in front of the houses and things of that sort, and also grand larceny of autos, where we've seen a 70% increase in that. So just get it out there, please, to ensure that you're securing your vehicles, you're not leaving valuables in your vehicles, and that, and if it is found that something is stolen, please report it to us. A lot of times we are going to jobs and they're like, oh yeah, this happened a week ago or 2 weeks ago, but they never reported it to us. So by that time, cameras have recorded over, so we're unable to do a thorough investigation. So that's all I have right now. I'll take any questions if Celeste, if that's what you want. I'll take any questions.
Yes, board members, any questions for the captain this evening? And members of the public, feel free to drop any questions in the Q&A or comments in the chat. Going once, going twice. All right. Well, thank you, Captain.
Thank you very much.
All right. And so I did see something in the chat while the captain was giving his report, and I just want to acknowledge and give Jared Spafford an opportunity to introduce himself and provide his contact info. Jared?
Hey, everybody. Really appreciate a couple minutes. It's nice to meet all of you. Yeah, I'm the Director of Operations and the Program Director at Sweet Generation. We're a bakery. We moved from the East Village to the neighborhood about a year ago now. From the inception of the business, it's always been a youth workforce development program, young people 16 to 24. We run anywhere between 150 to 250 hours of internship hours in either the front or back of house, hospitality, customer service, or like fundamentals of baking, work in a professional kitchen. And we staff our business almost exclusively through that internship program. I think in about the 10 years the business has been in effect, we've hired about 73% of our.
Jared, I'm so sorry, excuse me,
Yeah.
Just your contact information right now. It's just name and contact info. There'll be opportunity for more info later. Yeah, sorry about that.
Yeah, and if you want to come to the Youth and Education Committee meeting, you can, and you can do a presentation and tell us what you got so we can bring some of our youth there. But just tell us the time, location, and then after we can talk.
Thank you.
Perfect. All right. And I saw Joanna. Thank you to our parliamentarian for also helping keep us on track. All right, so I believe that concludes the chairperson's report. Thank you, everyone, and we'll keep moving on with our agenda for this evening. Again, if folks weren't able to provide their name and contact info, there will be an announcements portion a little bit later in the meeting where you can share additional information as well. Now we'll move on to, I believe, my report, which is the district manager's report. It was a very busy past month, so I'm not going to go through
Someone asked the captain a question in the chat. It said, will these officers help us with the quality of life issues? Captain Sanabria? I don't think so, but someone asked that question.
Yeah, so yeah, after I asked if there were any questions, it was a little bit late.
All right.
So I don't know, we may have to pass that along. Yeah, we may have to pass that along. Yeah.
I could just briefly say in 30 seconds that it's meant to be specifically towards gun crimes. The primary focus is not for them to be doing low-level quality of life things, and we can share more later, but no.
Okay.
Got it. Thank you. All right. Before I go, okay, all right, no problem. Just want to make sure we got everybody. Thank you, Mr. Camacho. So for my report, I don't have the usual report, although I do just want to start out. Just give me one moment to pull it up. So good evening, everyone, and happy Women's History Month.
Should I put you on the spot now?
What are you gonna do?
Could you read your poem for me, for us?
I would,
please,
but I would have to.
Please.
I would have to.
Do it quick. 2 minutes. 2 minutes. Okay. But people can listen to it.
But
2 minutes, please.
So yes, but I have to find it. I have to get it out of my coat pocket.
Right.
So, but I'll do it under announcements. I promise. But thank you. And just to speak to this, Mr. Camacho and I had the great honor of participating in Taxilandia, which for those of you that may know, Modesto Flaco Jimenez, a local artist, also the founder of Oye Group. He invited us to participate in this. Yes, poet. Yeah, a lot of folks commenting in the chat. We were able to go on this experience, right? A drive through the neighborhood, a trip through time. It was interactive, where Flaco basically gives us his story, right? And I think what was interesting, right, is that anyone, right, could really get in that car if they lived in Bushwick for a while and tell their story. So while he was pointing out the things that resonated with him, Mr. Camacho was like, oh, man, we barely made it off the block. And Mr. Camacho was already in his feelings, but it was a very beautiful experience. We had notebooks. We were taking some notes. I happened to write a poem. It just happened. And then Flaco was like, I want to take it. And I'm like, no, that's my poem. I'm gonna take that with me. So, and I read it to Mr. Camacho the other day, very, very beautiful. I highly recommend it to folks. It's a way for us to remember who we are, remember what Bushwick is, right? You know, even though we're seeing so many changes on a daily basis, we all have a story and a reason, you know, we're here, you know, our family ended up here. So I highly recommend it. But that being said, getting back into my report, and thank you folks for dropping stuff in the chat. I just want to acknowledge again, Happy Women Histories Month, and I wanna take a moment to acknowledge, right, again, getting back to our culture and some of our elders in the community and some of the leaders in Bushwick. Just give me 1 second to pull it up. As some of you may know, many women from Bushwick dedicated their lives to serving the neighborhood and or the city at large. And I just want to take this moment to acknowledge them. I know our board members will remember Avalar Hansley, A. Shanita Carter, Elaine King, Julie Dent and Nadine Whitted, Angela Battaglia, and many, some of these were board members, district managers, so many, even our current board members that identify female, women, she, her, hers, they, them. You know, we want to take this moment to say thank you for your contributions to this community. We appreciate you and your efforts and everything that you do. We know that it takes a village, right? And without all the help that we have, we wouldn't be where we're at. So thank you, everyone. And with that said, I'm gonna just summarize and point out a few of the meetings that I found very interesting within the past month. Some of you may be familiar with the Department of Design and Construction. They have a program called Town and Gown. This program in particular helps connect graduate students to city agencies that need a question answered. That's the easiest way to frame it. So let's say, you know, any agency is looking to implement a program. I was able to speak to some graduate students about NYCHA. They wanted to hear from the community perspective how, you know, NYCHA interfaces with the community board, you know, how they interface with other agencies. And so we were able to answer some of those questions, even though I did know in advance that we no longer have NYCHA within the district. I was able to speak to NYCHA when we previously were still under the umbrella. Now we have, of course, RAD. And we didn't really go too much into detail on that, but they were really thankful to have that information. And oh yes, and Miss Kelly, I just saw your message in the chat. Happy St. Patrick's Day to all those who celebrate and observe tomorrow. And also, I met with the Brooklyn Co-op. Some may be familiar with it on Myrtle Avenue. They also have the organizational side, Grow Brooklyn. They provide free tax prep services. There's also other programming. I know they have an estate planning workshop, other workshops that are super relevant and beneficial for the community. Please check them out, Grow Brooklyn. And I believe one of our board members, I know at some point, Jose, I don't know if you're still here. I know you were also affiliated with, I don't know if it's the Grow Brooklyn side or the co-op side.
I am happen to be the chair of the credit union side. So I'm glad you met with them. So yes.
Excellent. Perfect. And then, and I mentioned that, I wasn't sure which side it was. But I also met with my counterparts at Board 3 in Bed-Stuy and Board 16, which is Ocean Hill, Brownsville. We were able to confirm finally that Broadway is a priority for all of our community boards. And we had a quick conversation to identify some of the priorities if we're going to be meeting with the agencies and our elected officials. The short list so far includes reconstruction of Broadway, safety upgrades, lighting upgrades, and of course, rehabilitation for the JZ line. So hopefully we'll be having a productive conversation next Thursday. This is an interagency meeting, the Department of Transportation, the MTA, NYPD, and I believe even the Economic Development Corporation. Thank you to Desmond for shouting them out and making sure we include them on this. And all of our elected officials, of course, will be there. We're hoping to make this a reality. We know it's very challenging, a major capital project, but we got to start somewhere. So, and next I have a meeting. It was the community partners meeting for Patrol Borough Brooklyn North. Inspector Muscal invited me to share a little bit more about what community boards do. I gave a very brief 5-minute presentation. Happy to do that. Put in a request if you ever want to learn a little bit more about what community boards do. To all of the community partners for North Brooklyn, There were some questions, and I think we were able to have a productive conversation. Folks learned a little bit more. Granted, every community board is different. So what we do here in Community Board 4 may not be exactly the same, as Board 1, Board 3, Board 16, but the core responsibilities of every community board remain the same. And I already spoke about us going on the Taxilandia experience. And so I believe that concludes my report. Thank you, everyone. All right. Any questions, comments before we move on? Going once, going twice. All right. Thank you. And so we'll go on now with our committee reports, and we'll start in alphabetical order this evening with our Civic, Public Safety, Religious, Ms. Fellon.
Good evening. I'm going to start off. We met on Thursday, March 10th. We had a presentation by the Homeland Security Investigation Unit, the Human Trafficking Task Force. This was very, very interesting. It turns out that it's a federal agency that has two police officers assigned to work with the investigative agent. In the past 18 months, the task force has rescued over 20 children and arrested 12 individuals. They've identified 123 children who were trafficked, and they've worked with and tried to place and deal with 900 other children. The assistant specialist for the HSI, human trafficking, advised us that the unit deals with immigrants and victims with continued presence, which establishes immigration status to be able to cooperate with the investigations of these units. One of the things that they pointed out to us is that Brooklyn has become a suspicious area, and they focus on Pitkin Avenue and Pennsylvania Avenue. And they asked us to keep your eyes open, keep your ears open, and please, if you see or hear anything that's suspicious, please reach out to them and they will investigate. Mr. Camacho and I did our budget presentation to the committee, and we moved on to the old business dealing with the rat problem that Riseboro has at 1328 Gates Avenue. We discussed the Bushwick Parade, which is going to be on June 9th. I attended the town hall meeting that Congresswoman Sandy Nurse had, and one of the things that she pointed out was that on March 22nd, she's going to have another town hall, which will focus on Broadway Junction. I'm sure she'll mention that even further. Sanitation did a presentation and advised us that street sweeping is back in effect and summonses will be issued. I met with PSA 3 on February 9th, at which time we were advised that Hope Gardens, Bushwick 1 and 2 are no longer part of NYCHA. The 311 system has refreshed their system, and any complaints about Bushwick 1, 2, or Hope Gardens will not be directed to NYCHA, but to the respective agency of complaint. I attended the A3 Precinct Council meeting, and one of the emphasis was on the grand larceny of autos. And the last thing I did was on March 10th, I attended the New York State Cannabis Control Board meeting. They focused on strengthening on their office capacity, their recruiting, interviewing, hiring, and training. Job postings can be found on their website. And the committee decided that we were offered a training session by the New York City Human Rights Commission for the bystander intervention training. However, the committee felt that we needed then to come and do a presentation on what this is about before we decide on going into a training session on something that we were not familiar with. And that was it for our committee.
Any questions, comments? All right, going once, going twice. Thank you, Ms. Spellin.
You're welcome.
All right, next we have Economic Development plus Permits and Licenses, Desmond Monroe and Melissa Carrera. Desmond, if you want to go first.
Sure, it'll be really quick. Fortunately, I was late to that meeting that day. So basically, it was the Economic Development Representative Small Business Program for National Grid. It was just an informal presentation, and the gist of it is that the program offers funds for regional or local economic development partners and organizations to provide direct outreach and technical guidance to small Main Street businesses in the National Grid service territory. Applications will be accepted on a rolling basis until available funding is allocated or until March 31st, 2022. I was late for that call, and it says in the notes that the chairperson asked for more information concerning that bid, and they'll be getting back to us. Melissa?
Thank you, Desmond. Good evening, everyone. So just continuing the report from our meeting on March 8th, we had one agenda item in regards to the state liquor license application review for the business, The Witching Hour LLC, located at 1312 Decatur Street. It's a new application for a full liquor license. This establishment was formerly a clothing store, so there was no, restaurant or any type of food and beverage operating business here before. The owner has lived in Bushwick for 5 years and has 2 other bar establishments located in Fort Greene, Brooklyn. The manager did let us know that he did some outreach with neighbors and also businesses and schools really located near the 5-block radius, just to find opportunities for potential collaboration. Their intended sales of alcohol hours that were stated in the committee are as follow: 7 days a week, Monday through Wednesday from 5 p.m. to 2 a.m., Thursday through Saturday from 5 p.m. to 3 a.m., and Sunday from 5 p.m. to 2 a.m. We did request some additional information regarding soundproofing, just to make sure, because it is a primary residential area, that they have done their job to soundproof and actively working. And they did tell us they were actively working with audio engineers to further secure, the rest of the space. It is a blank, white space, a white box, like some folks like to reference. So we did also discuss our stipulation of no sales of alcohol past 12 a.m. on Sundays, which the owner of the establishment did agree to. And they did explain to us that they were possibly considering doing an outdoor patio, which would close by 10 p.m. all 7 days a week. We also did let them know we have our stipulation of outdoor spaces / patios having to be closed by 10 p.m. And this is something that as a committee, we have, set the standard for all businesses just to, keep the quality of life and noise somewhat under control. And we did invite the owner of the establishment to come join us today just to listen in and provide any information if anyone has any. Otherwise, we also did review the CB4 Statement of District Needs during this meeting. Most of them really fell under economic development. So we did review them, and I know Desmond shared some feedback with Celeste and the board's office in regards to the budget requests. Otherwise, I don't think we reviewed anything else. We will be reviewing the stipulation sheets next month in our meeting and going over that and presenting that to the committee next month. But that sums up my report. Thank you so much. If you have any questions or concerns, please ask away.
All right. And if board members, If you will allow, I was going to ask the business owner to just provide brief information, name, contact info, and how long if it's new business or just a little bit information, would that be okay?
Absolutely. Yeah, my name is Ty. Ty Lee. I'll put the into the chat. And my phone number is 347-671-7384. Like I said during the other committee board meeting, establishing relationships with neighbors around, very important to me, having a direct line to my phone just for any concerns or feedback you might have. Super important. I'll also put my email into the chat as well. Just ty@witchinghourbk.com. For those who want to know more about the concept of the space, this is going to be my own personal. I'll be the sole proprietor of the space. The other two places, I've had partners there. But since I bought this house 5 years ago, I've always wanted to have this space and be part of the community. And so I'm just going to create a very small kind of cocktail space that has like kind of low lighting, smooth music, very low so you can still have conversation, because the idea would be a setting that you can have a romantic date on, or you can kind of hang out with some friends nearby. And then there will be a stage that's about 4 by 6 feet. So it'll be like acoustic musicians, maybe some like smooth, like Sade-esque, DJs. So it's a very small space. So not looking to do anything rowdy or anything, and just serving house cocktails and being accessible to the community.
Thank you. Any questions for the committee or the business owner? Going once, going twice.
And also, anyone from the outside that's here that has any concerns or issue or close to there or anything, please let us know. We want to open it up to everyone now, because we don't want to say that we didn't address the concerns and issues, which I think he did go to some of the areas there. So we want to thank you.
Perfect. Thank you, Mr. Camacho. All right. So hearing no other questions or comments, we'll move on now to our next committee report. And I believe, yes, that is Environmental Protection, Transportation, Sanitation, plus Parks and Recreation. Barbara Jackson.
Grace and peace, everyone. On February 24th, we had a presentation from Sarah, I'll just say Sarah B, I can't say her last name, from the Environmental Education Trees of New York. And she had a very good program. She also told us they have an 8-hour classroom where we could sign up to have a tree pruning where we could take the course, but we needed to get a funding grant. So if Ms. Nurse is still on the line, we would like to let you know about that, because by getting a grant, and some of us could go and don't have to pay the full fee, we could pay less. By doing this tree pruning program, we could then prune the trees in our neighborhood, especially on our block. Also, they also have a volunteer event where you can take care of trees in the neighborhood. And she also know if there's any empty tree bases that we could get in contact with her, and they would come and they would fix it up. And they have programs in the school. But again, we really want to have the tree pruning program in Bushwick. So we're gonna be contacting you, Ms. Nurse, so we could get this program. Also, the parks meeting, we had the applications for the baseball fields, and they were giving out. And also we had the Bushwick Traffic Safety Review. And on March 3rd, I attended the sanitation work group meeting. And that's my report. Any questions? Good.
No, Madam Chair, I just want to reiterate in regards to I know our councilwoman there. What it is that they do the prune training course, and they charge $100 a head. So and they said they needed a location. It's a 6-week course, and you do on-the-job training, meaning they'll take you to the spots and they'll teach you how to do it. You get certified for 5 years. After the 5 years is up, you take the test again, and you get recertified again. I don't know if the fee is less or but it's a 5-year. Before it was only 2 years, because I remember we had gotten funding through Victor Robles, and we had did it, and I had the license myself and was pruning some of these trees and cleaning the flower beds and that. So we wanted to see if some of the people within the community or within the board, we would get a location and she would teach the course. There's a 6-week course. She told us, so maybe we could sit down and talk. I don't know how many people will want to sign on to this. I got to find out the place where we can, the location that we can do it. And hopefully we want to do it in the summer when we're off, July or August. You have a 6-week course. You go 1 time a week, and hopefully we can help. We can get help from you and Jennifer, or maybe you guys could put the whole pot and we can just sit down and take the course. I don't know. How's that, Barbara, Miss Jackson?
But also, when you take this course, you have to be committed. You just can't say, I'm gonna sign up and don't come.
That's right. You saying you coming in there, you got to do 6 weeks. If you miss one, they will not give you, lose the money. So you got to be committed. It's a 6-week course. So don't sign up if you're not going to take it, because then our councilwoman, both of them are going to ring us up. You have to pay back. Outside a contract, you got to pay back if you don't come. You got to give us the 100. Matter of fact, we'll double it up and put interest on it. Now,
Any other questions or comments for Barbara's report?
Oh yeah, yes, I have one. Madam Chair, yes, I did the schedule for the parks for the permits. Only Quebradilla, Rio Guadalupe, and Super Kids were the only one that took the permits. Bushwick High School for Rio Guadalupe, they got from Sunday to Thursday. Friday and Saturday, Super Kid has. Hexer Park, it's all Super Kids have the soccer league. Thomas Borland is completely empty. Nobody wants to use it because they say there's a lot of shootings from across the street and incidents are occurring and nobody want to use the park. So that park is open. Hope Park, Quebradilla has it the 7 days, Monday through Friday from 4 to 8, and Sunday from 8 to 8, and Saturday from 8 to 8. And also Green and Knoll, we have a lot of issues with the dogs. They say they they repaved it, they seeded, the dogs are making holes. I seen a whole bunch of dogs out there today. They're making holes on the grounds again. They're trying to control it. We're trying to see if we can get a fence around it. But Guadalupe, Quebradilla is going to use it Monday from 8 to 8, Sunday from 4 to 6. Tuesday is going to be a Williamsburg Sports League. Wednesday, Williamsburg, and Thursday, Williamsburg Sports League from 4 to 8, and Friday and Saturday is Quebradilla. So that is the schedule that I have here, Madam Chair, and I'll give it to you for you can sign off on it, and you can send it to the Park Department, and you guys have to vote on it today. Thank you. Or you got to do a blanket vote in regards to all those because there's only 3 leagues. Thank you.
All right. Okay, so I believe that wraps it up for this committee. We'll move on to the next committee report now, which is our Health, Human Service, Senior Citizens, Veterans. Cheryl, are you there? Oh, hold on one moment. I just got an email from Cheryl. I'm not sure if we have an issue with the call-in information. I will summarize, and then I'll make sure to check the attendee list. There were 2 presenters. It was largely informational. The meeting was under an hour. The first presenter was NYC Health and Hospitals, Gotham Health. They spoke a little bit about 815 Broadway, which is a new COVID-19 Center for Excellence on the corner of Ellery. The entrance is actually on Ellery at Broadway. It's a new facility that will be providing primary care and so many other services. Right now, they're focused primarily on the primary care aspect, as they just opened on Valentine's Day. That was the ribbon cutting. Mr. Camacho and I were there, along with our elected officials. And I saw you, Ms. Spellin. And we also, I believe, had another presentation that evening about 335 Central, which is our district public health office that's run by the Department of Health and Mental Hygiene. A large part of that facility is actually used by Gotham Health as well for a center there where they also provide other services. So we've asked for them to share with us a one-pager detailing the services that are available at both. We know that there have been a lot of concerns, particularly from the board, about 335 Central Avenue. We do have a walkthrough scheduled for the end of this month, and we made sure to let the council member's office know as well. So hopefully we'll have some representation coming from council member nurse's office that evening or that morning. Actually, it's going to be at 9 a.m. and we'll get a better understanding of what's going on and what we can do to improve the community relations with that site. After the Gotham Health presentations, we moved on. There was a representative from Live On New York. Live On New York is a nonprofit that is responsible for organ donations and for folks. So when you have a loved one that passes away, they are the ones that will approach you in the hospital. And it's a very delicate, of course, and sensitive conversation to have. However, they provided us some data on folks from the community that are on waiting lists for transplants. They also spoke a little bit about I believe both a recent firefighter as well as Officer Mora, who folks may recall. I know we had some board members attend the funeral, the services. Both of them were signed up to be organ donors, and they were able to save lives. And I'm gonna go ahead and let Ms. Spellin provide her quick update and see if I can make sure that Cheryl Jones is able to join us because she's emailing me. So Ms. Spellin, if you want to go ahead and finish your report.
Yes, there was one thing I left out and Barbara Smith reminded me of it. To all those who have 3-family and above houses, you must follow through on the local 152 inspections. And the inspection must be done by a licensed plumber. It's very important that you do that with a licensed plumber because the departments of buildings will kick it back and it's going to cost you extra money. You got to be careful about who you get to do your work. You do your investigation because there are a lot of plumbers that are running around sending out flyers saying that they'll charge you this amount, that amount, other amounts when they shouldn't be charging you that much money. So remember, local law 152 went into effect in January and you have until December to get it completed.
All right. Thank you, Ms. Spellin. And Cheryl, you should be able to unmute now. All right. Okay. So there might be a technical issue. But if anything, we'll circle back. I believe I summarized the majority of the health committee's report. There was also a review as our other committees of the district needs. So for the most part, everything was confirmed as a need. And we will be following up on the 335 Central item as previously mentioned. All right. And Ms. Jones, I apologize. I did try to ask you to unmute. I'm not sure why it won't let you unmute. So, but you should be able to use *6 to unmute. That's for anyone on the phone. It's *6 to unmute and *9 to raise your hand. All right. Any questions for any of the committee reports before we move on? Going once, going twice. All right. Oh, Joanna.
Yeah, I have a request, and that's of Ms. Cabrera's committee.
Hello?
It would be helpful to, hello, hi, can you hear me?
Yeah, sure. I think
Okay.
Cheryl just unmuted. That's, sorry. Yeah, go ahead.
I'll let her, okay.
Oh.
When she gives the addresses of the places that are applying for liquor licenses, it would be helpful to me and maybe perhaps other members of the committee to give the cross street to just say 1312 Decatur Street. You know, it would be helpful if she said, and at the corner of Knickerbocker Avenue. So we kind of get an idea where these places are actually located. I'm not asking too much, but I think it would give us a little clarity, at least me. Thank you.
Yeah, we've done that before, so we'd be happy to help assist the committee, Melissa, with that, so moving forward. So
Thank you.
you're welcome.
Hi, Celeste. Hello, board members. Can I make one announcement that we'll be having our Bushwick Shape Up this year, and we hope that we all the board members get to come out and attend. It's going to be a great year. Last year we had tabling, we had healthcare facilities. We had to move it, and it was still very successful. So we're very excited to host Shape Up Bushwick this year again. And thank you, Celeste, for I had technical difficulties. My personal phone number died. I logged in with my work number.
No problem. I'll save it just so we don't have any issues moving forward.
Yes.
Okay. Perfect. And that's a perfect segue to Ms. Davis. If there are any other Shape Up updates you want it very brief, you can share those now.
Well, no, there's nothing in addition, except that we're having our next meeting on the 24th at 2 p.m. But we're still going to have it on the 9th of June. It's still going to be from 10 to 2, with us starting at 9 o'clock to set up and finish at 3 o'clock for cleanup. The theme, pressing forward, standing united, and we're looking for volunteers to give us a hand. So if anybody would like to attend the meeting, the planning meeting, which again will be on March the 24th at 2 p.m., we would greatly appreciate it.
Yes, and I'd like to also thank you so very much for supporting Bushwick Shape Up. We could not do it without you, that you're a rock star. So thank you again. And you have my 210% support. The flyer, I'll make sure that I'll have healthcare Woodhull be there. We'll ask them to come. We'll ask other healthcare facilities. And so, thank you for being our rock star.
Thank you.
Thank you for Camacho giving our rock star.
Oh, too much. All right, then. So I believe, Barbara, did you have something? Barbara Smith?
No, I was going to make an announcement when it's time.
Oh, okay. So yeah, we'll move on from our committee. That concludes our committee reports. So we'll go ahead and move on now to our recommendations. I believe we just have 2 committees making recommendations this evening, and we'll start with environmental protection, transportation, sanitation, and parks and recreation. The first recommendation is for the Bushwick Avenue traffic safety study, which is the presentation we heard earlier today. So all of those recommendations, in addition to the ones the committee included as well, which was, I believe, the one from Captain Claxon. And then there were just some other, like the technical language for like the actual tools that they would be using. Some of you, if you've driven through Queens recently in Ridgewood, they have it's a speed reducer. It's a small hump that's yellow and black, and it goes when you're about to make a left turn. We asked specifically for them to explore whether or not they would be able to add those as well to Bushwick Avenue as another traffic calming tool. So if the committee, if Barbara, did I get everything for that recommendation? Is there anything that I missed? Barbara Jackson? You muted? All right, perhaps she had to step away. Oh.
You covered everything, I'm sorry.
Oh, no problem. All right, so just want to make sure. So is there a motion for this particular recommendation from the board?
I can make a motion, can I? No.
Jose
Guzman make a motion.
Okay, so Jose Guzman made the motion. Is there a second?
A second.
That was Jared Hicks, I believe. All in favor?
Aye. Aye.
Any opposed? Any abstentions? So moved. Now, the second recommendation from this committee is for the league field permits for this spring. And Mr. Camacho reviewed the times and the league schedule. So every year we work with parks to make sure that there's fair use of all of the fields within the district. We know that they're limited. Is there a recommendation from the board for this year's schedule?
All right, Jared Hicks makes a motion to accept the terms on those soccer fields.
Got it.
Second.
Okay. All in favor?
Aye. Aye.
Any opposed? Any abstentions? So moved. All right. And I believe that covers it for this committee. We'll move on now to economic development and permits and licenses. Melissa, do you want to summarize the one recommendation?
Yes, thank you, Celeste. So the one recommendation coming out of our meeting is for the establishment, the Witching Hour LLC. The committee motioned to vote in approval of the establishments with the hours presented to the committee with recognitions of stipulations in place. And everyone can reference the notes in our report. Which means no sales of alcohol after 12 a.m. on Sundays, and ensuring that there's soundproofing done before, the opening of the business, as well as closing down the patio or outdoor space at 10 p.m. 7 days a week. That is the only recommendation for the committee this month.
And would you be able to reiterate the hours, Melissa?
Yes, so the hours are Monday through Wednesday from 5 p.m. to 2 a.m., Thursday through Saturday from 5 p.m. to 3 a.m., and Sunday from 5 p.m. to 2 a.m.
Got it. Okay. Is there a motion from the board for this recommendation? Anyone? Someone?
James Fisher make a motion.
Thank you, James. Is there a second?
I second. Jared seconds.
Okay. Jared Hicks seconds. All in favor?
Aye.
Any opposed? Any abstained?
Ovina Davis abstained.
Okay.
Can we get the address and the cross streets, just for clarification, for information?
The address is 1312 Decatur Street with cross streets Knickerbocker Avenue.
All right, thank you.
So welcome. Thank you. I believe that concludes our recommendations for this evening. If there's anything else, now's the time. Going once, going twice. All right. We'll move on now to old business. Any old business? Going once, going twice. Any new business? Going once, going twice. And announcements, please raise your hand. And as promised, I will read the poem that Mr. Camacho asked for me to read to everyone. So if you left the meeting already, you missed out. But if you're still here, get ready. All right, I hope you can hear me well. History, our story. The noise in streets, in the shadows, flames flickering, block skipping, their stories. If folks can just mute if you're not speaking. Sorry about that. All right. So I'll take it from this. So history, our story. The noise in the streets, in the shadows, flames flickering, block skipping, their stories. Mis padres, Pedro or Piri, Ivan or Smiley. La música de calle calls me, venga pa' acá. La cultura tuya, ours. The cold air bringing me back. You're not from here, kid. Your parents took you away. But look at this. You found your way back home. Chipping paint, graffiti stains, multicolor memories like the row houses on the blocks, historic homes not landmarked, just another sign of neglect. The city double standard, check boxes, racial inequity, and capacity limits. Education imminent, provident, the barriers to the fight that prove we matter before we exist. Moments of learning not passed down to us. Why is it a fight for everything we have? New Montessori failed, came too soon. A vacant lot, new housing standing for over 5 years, elevated by our own economy. It's like I told you when I didn't even realize what I was saying. If Bushwick is not Bushwick, then who am I? All the things they said we'd never be. Something, educated, alive.
Very nice.
Very nice.
That.
All
You
right.
will,
Thank you.
you will not be the board
Very
manager
nice, Celeste.
in 5 years. You're gonna be gone.
Very nice.
Thank you, everyone. I got a little nervous. I do these meetings all the time, but I was like reading my poem. I don't ever do my work. I have goosebumps over here. I'm a little freaking out, but we're good. I'm back in work mode now.
And Desmond, next time you're gonna do yours, because I know you got one.
You mean Dustin, right?
Dustin.
She makes my notes look real bad.
Excuse me?
I'm glad I left him with Flacco.
I don't have poems. Mine will sound like a 1970s Richard Pryor stand-up. So.
So yeah, just
we're going to lose the left.
no, not at all, not at all. So, but let's continue with the meeting, and we have some surprises coming up. So please stay tuned and check out our meeting agenda, specifically arts, culture, technology. There's going to be some exciting stuff coming your way for the community. And just to get back to the rest of our announcements, I know Jessica, you had your hand up first, followed by Jonathan. Any other announcements, please raise your hand. Jessica, go for it.
Celeste, you got to send it to me in an email. My phone died. I had to log back in. So I just want to tell you, I'm extremely, it elates me to know that more and more folks are into the arts. And we have people like Flaco Navaja, who's in the community. You know what I'm saying? I was in charge of Capicu Pal Pueblo charity. Capicu is a group of folks that were doing art pieces and poetry. So a quick announcement is Mr. Calise, the CEO, had mentioned about the CHNA, Community Health Needs Assessment. And in speaking and having this communication with you guys, I am certain you've already shared that information with folks. But if you could please reshare it with the people, because on the 28th at 6 p.m. we will be having a public forum, and so central office would be there manning it. Except that the public forum really is for folks to talk about the needs, the community to speak about the needs, so that they can incorporate it into the hospital. Secondly, and most importantly, is they have a survey. As much as we think surveys really don't do anything, they really do a lot. So it's one thing for you to get online, but if you don't get online, please still fill out that survey. There's a community health needs survey, and it has the little code, the barcode. You just put your phone, the camera to it. It's just a very few amount of questions. So that's one. Two, I forgot what two was. I'm telling you, I have some timers. Sometimes I remember, sometimes I don't. But oh yeah, so you guys are having an event, and I spoke with Camacho, and Camacho will be picking up this Friday. I have a friend who's bringing me crates of hand sanitizer, hand wipes, and gloves. So I reached out to the elected because they don't get things, they don't get those kinds of things to give out to community. And for the event that I'm glad Cheryl Jones is online, because I had forwarded the information to her supervisor so that we can get folks to come out from Woodhall for the tabling and to provide information on the day of the event. So I'm looking forward to it, and to being out in the community and doing the things that we do, helping our community out. Thank you.
Thank you. And next, I believe we have Jonathan.
Hi, everyone. Good evening. Jonathan from Brooklyn DA Eric Gonzalez's office. Just a quick announcement. The DA is accepting applications to the 2022 spring high school internship. The deadline is April 1st. The internship is 1 week long, from April 18th to April 22nd. And it's for high school juniors and seniors who either live or attend high school in Brooklyn. The requirements are a resume, personal essay that's 250 words, and the topic question is, why do you want an internship at the DA's office, and how will an internship help support your interests? And you could find more information on social media or visit brooklyndA.org/internships. Thank you.
Thank you. And Lucy?
Hey everyone, thanks for having me again. I'll pass on your congratulations to Noel. We're very excited to meet the latest addition to the Bushwick Staff family. I have two announcements. We have a show happening at the moment in collaboration with the El Puente Leadership Center in Williamsburg. It's called A Song of Songs. By Agnes Berinsky, and we'll send over information. So that's our show. And then we also have community autistic workshops, which are hosted by Michelle J. Rodriguez. And those happen on Fridays on Zoom. So anyone can join in from 4:30 to 6:30 p.m. the third Friday every month. And I'm going to put more info about that in the chat and a link. And let us know, reach out with any questions you have about either of those things. Thank you so much, and I hope to see some of you around.
Thank you. Any other announcements?
Barbara.
Please raise your hand. Oh, Barbara, go ahead, Barbara.
Oh, I just want to put out to the community. The precinct is getting a lot of calls about sanitation problems. The police can't do anything about garbage, and they're getting bombarded with calls saying that garbage is in the street, other people's garbage is on their sidewalk. This is not a police problem. I'm sorry to tell you, I'm a homeowner too. You're responsible for 18 inches into the curb. If it's your garbage or not, you're gonna get a ticket. And I'm sorry to tell you, I got a $300 ticket. You have to babysit the tree in front of your property. If it's dirty, you have to clean it. You can't say it's not my garbage, it came from over there. So a lot of people are complaining about garbage. I'm sorry to tell you, you can call 911, but it's not a police problem. So I'm sorry to say. And also, I want to say congratulations to all the women. Like they said, yesterday, the 83rd Precinct Community Council, we honored all our PAAs in the precinct, which was 17 ladies. Nobody knows about them, and they're the hands on the clock that make the precinct run. They're in the back, police assistant administrators that do all the paperwork. So, you know, this is a good month for a lot of women that really don't be in the front line to be pushed up from the back. And congratulations to all the women. Thank you.
Thank you.
Thank
And
you, Barbara.
thank you, Barbara. It was really exciting to hear about the luncheon at the precinct. I know I saw the photo too. I liked it on Twitter today.
Thank you. It was real nice that Chief Henderson came and supported the girls.
Excellent. And just a quick comment from the chat. Someone asked for the link to the community health assessment survey. Jessica, I don't know if you'd be able to drop the link in the chat, but if so, you can also reach out to our office. We can share that information as well. If for whatever reason we don't get the link today. I tried to check the flyer I have, and I don't have the updated link. It looks like it's not going to the right page.
Is she taking any paper? Because everybody ain't computer sassy like you guys. Is there any paper?
Yeah.
The old school like they used to be, you know, maybe you can send something to the board and we'll get people that are not computer sassy, especially from the community, and we can have it, or you can bring them that day too. If that's supposed to be you can give them out.
They have to do it online. They have to do it online. I will forward it again tomorrow, but I can't from my phone for some reason. I was trying to share it, but this job phone doesn't let me download the items.
It's all right. Send it to Celeste. She'll send it to everyone. Thank you.
And if anyone needs assistance completing the form, we can do that in the board's office. Just give us a call. We'll help you fill it out if there's no paper. Okay, so I believe that concludes our announcements. Just one last call from anyone going once, going twice. All right. We'll move on now to our second roll call. Board members, please be ready. Carlotta Williams.
Here.
Jerry Valentine.
Present. Good night.
Leo Teneo.
Present. Good night.
Oh, goodness.
Annette Spellin.
Present and good night.
Dustin Sonborn.
Present.
Barbara Smith. Bernardino Shell. Eliseo Ruiz. Raul Rubio. Asaya Polite.
Present.
Uma Novoa.
Present. Good night.
Thank you. Sami Namir is excused. Desmond Monroe.
Present. Good night.
Mary McClellan. Andy Marte. Luisa Jose.
Good night.
Virgie Jones. Cheryl Jones.
Good night, everyone.
Kristen
Cheryl
Jock.
Jones.
Thank you.
Here. Good night.
Got it. Barbara Jackson.
Yeah.
Tanisha Honeygan. Jared Hicks.
Present and good night.
Hadia Harrison,
Present, good night.
Jose Guzman,
Present and good night.
and Guy's excused, Christopher Graham, Igaudy Gomez,
Present, good night.
Freddie Fowler, James Fitzgerald,
Present. Have a good night, everyone.
Carlos Feliciano, Alvina Davis,
Present and good night.
Andrew Choi, Felix Ceballos,
Present, good night, everyone.
Melissa Carrera,
Here, good night, everyone.
Gardier Caphart,
Present.
Robert Camacho,
Presente and good night all.
Rob Brown,
Present.
Martha Brown,
Present and good night.
Joshua Brown,
Yeah. Good night, people.
Joanna Bennett,
Present, good night.
and Reverend Grace Aids. Is there a motion from the board to adjourn?
Alvina Davis move.
Is there a second?
I second Melissa
Melissa
Carrera.
Carrera. All in favor?
Aye.
Any opposed? Any abstained? So moved. 8:29. We set a record. Have a good night.
Yay,
Yes, good
Yeah, I
night.
can eat. I can have my